Good evening, everybody. Welcome, welcome, welcome. This is our Tuesday evening call. Whenever you're listening to it, it's our introduction to a very special company, Lifewave, and a really amazing technology in photobiomodulation. And we get together to give a little history of the company and the technology and talk about the star of our show, which is our product, the X39, our stem cell activation patch. I am your host, Robin Blank Mascari. And then after we do a little bit of that, Gregory's going to do a presentation. Then we bring on our special guest. And tonight we have Dr. Tom Acklin, who is always a joy to have. And then it's time for you. If you have a question, if you have a story to share, it's the stories that really change people's lives because they can relate and they want the relief too. So we're here to enhance the quality of people's life and lifestyle. So we'll invite you to ask your questions in the chat. If you have a story to share, please raise your hand and we'll call on you and put them up right away. And remember, we don't mention any disease states. We are not here to heal, cure, or diagnose anything. We are here to share a natural product that helps the body do what the body does best, which is come back to homeostasis. So for us to get started, what I want to do is turn things over to my partner, and he's going to give a brief overview with a wonderful presentation. So Gregory, over to you.
Well, all righty now. Well, thanks very much, Robin, and good evening, everyone. And I'm going to give just a brief overview of Lifewave, our technology, the company, the industry, and what it can mean for you. And then I'm going to turn it back over to Robin and our good doctor. So I'll start out by sharing with you an awareness that I came to a number of years ago. Is I finally figured out what I want to be when I get older. Younger. Getting old is not so cool. And so welcome to the stem cell revolution, because everyone certainly wants to look, feel, perform, and live younger. And stem cells, I found out, are the key because they're a vital part of our immune system that help repair and regenerate damaged cells in all of our glands, organs, cellular tissue, muscles, bones, everywhere. So the problem is the older we get, the fewer stem cells we have and the less active they become. And by age 60, only a small percentage remain and their activity is really pretty low. So the fewer stem cells we have, the faster we age and the slower we heal. And so you might be saying, well, what about stem cell injections? Because they're getting quite popular, but they're quite expensive too. And they can be very painful, risky, controversial, and there's no guaranteed results. Well, here's the good news, because with Lifewave, you can now look, feel, perform, heal, and live younger with this historic breakthrough in stem cell technology. It's a new wearable technology in patch form. It's affordable, it's safe, non-invasive, it's non-drug. It's a patented form of phototherapy, and I'm going to jump into that a little deeper in just a couple of minutes here. It uses specific frequencies of light to increase and improve our stem cell activity. And it's the brainchild of David Schmidt, our visionary founder and CEO. Now, David is not only a visionary, he's also a brilliant scientist and researcher, and truly a genius inventor with over 100 patents and patent pendings. And David's been on the leading edge of phototherapy research and science for over 20 years, and he's already conducted over 90 clinical studies proving the efficacy of our Lifewave phototherapy technology and products. And the good news is many more clinical studies are in the works, and other exciting products are in the works too. So let me talk just a little bit about Lifewave. It's a 16-year-old company coming up on our 17th anniversary pretty soon. Founded in 2004 based on an energy-enhancing technology David developed for Navy SEALs to increase their strength, stamina, performance without drugs, stimulants, or caffeine. The technology and product was so effective, it's now used by world-class athletes around the world in almost every sport. We have corporate headquarters, laboratory, and manufacturing diversified between California, Utah, and Ireland. And I'm proud to say that we have global distribution to over 75 countries from 14 global distribution centers. Now, how does this amazing technology work? Well, it's based on a type of light therapy called photobiomodulation, and that's kind of a mouthful. But what that means is LifeWave patches contain a very specific combination of organic materials and nanocrystals. And when they're applied or near our body, they're activated via our body heat. And then they begin to emit very specific frequencies of light, which stimulate targeted and beneficial biochemical responses in our body. And this is known as photobiomodulation, and it is the foundation and basis of LifeWave phototherapy patches. Now, it's been a well-recognized and proven scientific principle that specific frequencies of light can cause very specific changes within our body. For example, when we go out in the sun, a very specific frequency of light causes our body to make vitamin D. We don't get a download of vitamin D from the sun, and it's not there before the sunlight hits our skin, but when it does, our body starts making vitamin D. Another frequency of sunlight, UV, causes our body to make melanin, the chemical that gives us a suntan. So LifeWave's patented technology is based on the same rock-solid, well-recognized scientific principle. I'm happy to say that for the last 11 years, the LifeWave's focus and David Schmidt, our founder's focus, has been in the field of anti-aging, and more than that, really into the field of regenerative science. And in January of 2019, a little over 2 years ago, we released to the global market the Lifewave X39 stem cell activation patch, which truly is a historic and affordable breakthrough in stem cell technology. And some are actually calling it the holy grail of anti-aging and restorative science, because we are actually doing what the multi-billion-dollar companies and big pharma have not been able to do. X39 actually activates a very specific copper peptide that activates our stem cells, while also altering gene expression towards a younger and more vibrant you. And yes, we have patents. Yes, we have clinical studies. And yes, we have tremendous field results proving that X39 is actually turning back our biological clock, helping people to look, feel, perform, and live younger. And for us baby boomers, this is very exciting news. So that's my quick summary. And Robin, I'm going to just turn it back to you to introduce our good doctor and take the call to the next level.
All right. You do such a great job. Everybody loves it. Thank you, Gregory. Well, I love introducing this man. He's turned into a very special friend too, and we're so grateful to have him in our LifeWave community. He has a background as an MD in neurology. He was at Georgetown, I want to get this right, University Medical Center, but he's made a shift in his life into more of the natural healing, and he's an expert in the microbiome and the brain-gut connection, and he's extraordinary, and he reads the clinicals. He understands what we have here. He is sharing it far and wide, and I love learning from this man. And I want to welcome Dr. Tom Acklin. Let's see your face.
Well, thank you, Ms. Robin. Nice to be here.
The traveler.
Be here, yes, indeed.
You're
I atop the Smoky Mountains today in Chattanooga.
Oh my goodness, is that where you were?
That's where I am.
How lovely. The world, this country is lucky that you're traveling around. Well, we're thrilled to have you, Dr. Tom, and I know that you have a passion about this technology and these products. And as a doctor, it's always good for people to hear why, as a practitioner, as an MD, are you really so excited about what we have here with LifeWave?
Well, it's interesting, the phrase you used when you said, I read and I understand, and I can't say that I do understand. A lot, yeah. But I think every really bright-eyed scientist, and I'm not patting myself on the back here, but healthy, thriving people is what we do here. And we put people in a place where they're hungry for their next thing, the next enlightenment. And that in order to have the next enlightenment, there has to be a little bit of an inherent, I don't understand fully, right? It doesn't mean you don't have some data, and it doesn't mean we don't have experience and skill sets and whatnot. But this is cutting edge stuff. It's really exciting.
All right. So you've read, and I love your joy. It's infectious. It's infectious. So Gregory explained a little bit about what we have here with photobiomodulation. We have this product that does many things. Could you share with people what it was designed to do? What is this copper peptide? Why is it so amazing?
Yeah. Well, everybody's been seeking the holy grail of
We
regenerative,
found it.
right? And everybody's been chasing stem cells. And there's no question in anybody's mind that stem cell transplants work. Stem cell therapies work profoundly, right? They're expensive, they're dangerous, sometimes they're illegal, they're hard to get to. They come with their own complications. And what do you know? We found a way without a drug. We found a way without actually putting something in the body to activate our native capacity to regenerate stem cells. Nobody's ever found that before. And we have this linear model of aging, that has taken over modern science. It says, you build a machine, the machine gets a certain capacity, and then all of a sudden it starts to decline and degrade. That's just built in, right? And we've kind of got it that victory is, well, I'm aging more slowly than my sister. I'm not quite as old as she is. And that, as if that's a victory. But what if we could actually flip that around and we could get younger and stronger and even better with every step? Yeah. So that's what we've done. This is a non-transdermal. We talk about our cornerstone product, X39, and talk about a scientist who's on the leading edge, even David Schmidt, brilliant guy who's been looking at this for decades. He was even surprised that it came this simply. He was looking for something else, and we are vibrational creatures. We're electromagnetic creatures, and excuse me, Gregory did a nice job. Of illustrating a couple of the different ways, that are historically accepted. But truly, any real leadership is a visibility issue. And I was thinking about this today, right? How do we contact life? How do we stay visible? How do we, A, see the problem or the challenge, whatever that is, B, mobilize resources, and then find a recovery or maybe even an enhancement of our previous version, right? Everybody knows that in a leadership capacity. Well, we know that in a regenerative physiology capacity. We actually know that the body can, when it has that capacity to see, recognize, mobilize resources, it actually has the capacity to grow younger. And that's what the stem cells do. We found a way to turn the body back into a place where it had the same vitality that it did when it was 16 years old. Sounds a little shocking, right? To somebody in their 40s, 50s, 60s, 70s. But stem cells are not yet committed tissues. Yeah. We talk about omnipotentiality as when you put this patch, you put X39 on the body, the resources go to where they're most needed. Why is that? Yeah. Why is that? It's a little quarter-sized thing that we stick on our body. It resonates with what's already in the body, which is a yearning, an electromagnetic frequency yearning, right? Every enzyme, every tissue in the body is putting out a signal. If we can enhance those signals, then we're in good shape. Then all of a sudden you've got that regenerative capacity. And that's what stem cells are. Stem cells, again, not committed not committed tissue lines, omnipotential, and they can become a spleen cell, or they can become an immune cell, or they can become a brain cell, right? I happen to be studying neuroplasticity for the past couple of decades, but that word plasticity is huge. It's something that now very excitingly is being integrated into regenerative and functional medicine conversations, where we know that what if you really did have kidney plasticity? What if you had liver plasticity? What if you had skin plasticity? And indeed you do, right? Every tissue in the body has a capacity to regenerate. So
what we have is a new paradigm on aging, is what I'm hearing.
It's exciting, groundbreaking, and it's what most scientists have been looking for. Most scientists who are footed in biophysiology and medical sciences and wellness and healing have been looking for this. And what do you know? We got it. It's pretty exciting.
It's thrilling that we don't have to buy into that model and let this vessel wear out. It can last for a long, long time and feel great. So what are the optimal conditions for people to make sure they get maximum effectiveness out of this, this product and this technology?
Well, I work a lot with lifestyle shift. You know, the past 15 years since I stopped writing prescriptions, help people detox, help people stop doing the things that actually bring them into the doc's office in the first place, right? So we talk often about forcing ourselves to sleep better, or forcing ourselves to exercise, or forcing ourselves to eat in a certain way. And in reality, yes, it's a good idea and it's a goal, but it's hard. You really can't force something like that, right? The body has a momentum. So what we do is we actually give the body a workable competence with these almost instantaneous phototherapies, these technologies that give the body that capacity. You can think of it as a crutch if you like, or you can think of it as an empowerment vehicle if you like. But it really does. A lot of our technologies work in seconds, and we suggest 90 days to 6 months of regular use, because there's a cumulative effect to a lot of these technologies. And then a lot of those lifestyle changes actually become urges, right? When you start wearing this, one of the great benefits for me was I was quite surprised that I had the urge to keep going. I'm an athlete. I have a fairly decent, healthy body, I think, for a mid-50s guy. Okay, late 50s. And no, but that wasn't the case when I was in my mid-40s. I was an overweight, unhappy, gray-haired guy, doc that didn't know how to take care of himself. Yeah. So, but we put ourselves back into a place, and for me, it took some work because I didn't have this. It took some discipline and hard work and lots of failure. The success rate with these technologies is stunning to me. I help people. A lot of what would normally take people 6 months to a year of very committed effort, not just personal effort, but really part of a regenerative, part of a lifestyle change means you have to educate the people around you as well. And that's actually the hard part, because diseases don't run in families because of human genes. They run in families because we all eat the same stuff and we breathe the same air and we pet the same animals like that. Yeah. And so when one person says, okay, enough, I'm going to get younger from here forward. I'm going to stop this getting sick thing, right? I want to do something different. Then the hard part is having people around you change their ways as well. And so that's a lot of what I saw is these goals that people are after actually become very workable very quickly with these technologies. And then you actually feel like going to sleep when it's time. You feel like resting when it's time. You feel like moving when it's time. And you feel like eating when it's time. And your body's responsive enough that when you eat the wrong stuff, you feel it. Yeah. So it's an education curve for sure.
Yeah, so you're talking lifestyle, because it's, everyone wants the magic pill, the magic patch, but we've got to do our part. And that's what I'm hearing you say. And our environment's really important. So the people around us, when we make a change, it does affect other people. So we want to make sure the whole environment is supportive. And so what kind of things can people expect when they use the X39? What are some of the benefits that people might experience? Because we have a lot of new people on the line tonight, and we'd love to kind of share what might happen to you, and might, because everyone's different, like you said.
Yeah, one of the first things I noticed that, and again, it was quite a surprise for me because I didn't expect, and luckily somebody was generous enough to give me a month's worth of product. And within the first couple of days, I noticed that I had extra stamina in my workout. Folks can expect to, if you are an athlete already, you can expect a boost in your athletic performance, both your desire to move and your capacity, your stamina and your strength. If you're not yet, you can expect to become one, right? And not everybody has a goal to be an athlete or to be in motion. That also is a habit. You know, that's a learned behavior. We get to a place where the body knows it can't handle movement, right? And so it gets into the habit of not moving. And then we've got these things that happen up here that start footing a reality of some sort. And then we start talking to ourselves and say, oh, I don't move. I don't like to walk. I don't like to run. I don't do stairs. I like to take the elevator. The kinds of things you can expect are surprising needs to move, surprising capability to move. I experienced not only deeper sleep and easier sleep, but I started remembering my dreams better. Mental clarity is a big piece of things. People can start thinking better. Yeah, and we're in a place right now where that ability to make decisions in the moment is compromised for a lot of people, right? So stress management, being able to navigate what are becoming very difficult days for a lot of people, right? We're handling a lot of things in modern days, and a regenerative capacity. And we're, again, we're not allowed to talk about curing or diagnosing, but anything that is on your medical chart that the doc says has been a problem, I would challenge everybody to say, hey, doc, when is this going to be better? And if he doesn't have an answer for you, if he doesn't have a path, suggest to him that you might want to be looking for somebody else, right? Suggest to him that you might want to not be on the medication that he says you need to be on for the rest of your life and things like that. So there are surprising recoveries from things that a lot of the modern world has decided there is no recovery from, right? And it can be everything from a condition that somebody called you, right, or down to a something that you called yourself, right?
And we don't want to own those things. And it's so wonderful to know that there's nothing that can't get better. It's just liberating, isn't it?
Isn't it great? And then all of a sudden you've got the energy and the drive to start making better lifestyle decisions too. People change their lives, they flip their careers, they they're better to their kids, their relationships improve. And most of the time, any place we're struggling in life, it's usually because we don't have the battery full to attend to that thing. And so we default into a practiced rebellion, right? A practiced judgment or a rebellion. So it's interesting to see how happy people get and how capable people get. I think that's the best part. And then all of a sudden people, then you're in a place where you really can be surprised.
Oh, I love it. I love it. And we are so blessed to get to share the great news of this literally historic breakthrough in affordable stem cell technology, because, a lot of the other choices in stem cell technology are not typically afforded for the average person, affordable. So we got a whole bunch of questions here in the chat. We got a few people with their hands up, and I'm going to go for the first person because they were Vangali was on right away, and she said, I have 3 client calls this week worried about blood pressure being so high. Is there anything we can do with the patches to support their blood pressure?
Sure. Vascular tree volume. So vascular tree volume is, think of it like a balloon. I like to describe this to people that when you're hydrated, it's not just water. It's not water, which is the blood inside your body, inside your veins and arteries. It is minerals and electrolytes, salts, nutrients, right? All of the dissolved stuff in the serum. And when that's there, then all of a sudden the water that we're actually drinking can be there, right? Then you've blown your balloon up, and then you don't have blood pressure problems. Usually a blood pressure issue is the body doing the right thing, right? It's not able to functionally squeeze and deliver the serum, the blood, into the target tissues. So what does it do? When you squeeze a hose, you got better penetration, right? You've got better flow and faster flow, stronger flow. And that's what high blood pressure is all about. Right. We can't claim to be able to heal high blood pressure, but the point is, when the body's in a place, back to our original idea, where you can see the tissue, you can see the damage, and then you have the capacity to deliver the repair nutrients to those tissues in real time, then there's not a problem anymore, right? And then the body doesn't have to work very hard. So it is a lifestyle shift, and it's not suggested that that's a quick fix, right? But it is, like we said, there's a cumulative effect over the months in using several of these different technologies. And the body gets hungrier for real food, which is the delivery vehicle for real nutrients, which is dissolved in real water. And the body gets hungrier for cleaner water and cleaner air. And what do you know, cleaner ideas. Yeah. And so we don't have to fight so hard, and then the body doesn't have to work so hard.
So are there any patches briefly? And we got a whole bunch of people with their hands up and a whole bunch of questions. So let's see how many we can get. Any patches you'd recommend for someone that has blood pressure challenges?
Sure. Icewave is a patch. It's a 2-patch system that we use, and we market it for pain relief. It's fantastic. It actually works in the moment, literally in seconds to minutes. And it is a pain relief, but part of the reason it's a pain relief is it increases blood flow. Doesn't turn off the mechanism. Doesn't, you take a steroid or an anti-inflammatory or a Tylenol or something, that turns off the pain mechanism. It constricts the area. This is actually a pain resolution technology where it forwards that. So you've got inflammatory markers, you've got inflammatory suggestions, if you will, to the tissues that properly say, hey, we're in pain, we need some help here. Icewave actually helps bring those blood vessels, those capillary beds back into a place where the tissue, the nutrients that need to get to those tissues can get there. And then all of a sudden you've got resolution. There's a similar effect with a technology that we have called Energy Enhancer. Energy Enhancer is a little bit more for the more mature tissues, tendons, muscles, and neuromuscular, that kind of thing. But it's a similar effect where, it really is about capillary bed flexibility. You put the body in a place where it can choose in the moment. Hey, we don't, nothing's going on over there. Or, hey, this guy's working out pretty hard. We've got some inflammation because he's doing extra pull-ups today, right? There's some tissue damage there, right? And then the body can put the right stuff in the right place.
Love it.
Yeah.
Okay, so let's alternate between stories and questions. And I want to make sure that all of you that have your hands up have a story to share, and please make it brief. Please mention symptoms only and what it was like before, which patch you used, and now what you can do really briefly. This is a good test. So we're going to let Anne talk. And Anne, I think you should be able to talk right now. You got to unmute your line, Anne. There you are. Hi. Are you there? Anne, you're unmuted. I'm not hearing you.
While we're waiting for her, Robin,
Yes.
it's one question about how do you talk to doctors. What I would suggest is, if you're excited about this and you see the possibility, you don't go and ask the doc because they don't know about it. And there's nothing wrong with docs, but they do what they do. I was one, I wish I could take back so much of what I told patients over those years, but they just don't know. A great way to approach a caretaker is to say, hey doc, I've decided to do this. Please take a very good look at me. Take whatever blood you want right now. I'm going to do this for 90 days, and then you can follow me, and then you take the blood afterwards. Right? That does two things. First of all, puts the patient in the driver's seat, right? We each have agency and sovereignty in our choices. It's supposed to be a doctor-patient relationship. So, and B, you'd be surprised at how many docs actually open their eyes. So people are doing a public service by carrying in the message that way. Yeah.
That's a great idea. Another thing that I do with practitioners, I just tell them I've come across this historic breakthrough in affordable stem cell technology. It activates this copper peptide. Would you go to PubMed and do your own research, and then let's talk? And I've had practitioners get very intrigued. So I've done that with several doctors. Okay.
You can also Google almost anything. And again, we can't claim to cure a disease state, but whatever disease state you think you have, you can Google it and the name of a patch or X39. And there are practitioners all over the world. And I promise you, you'll find a platform and you find a practitioner who's doing great work with these technologies.
Love it. Love it. So let's see, Vangali, you are available to talk. You have to unmute. And I've made you should be able to talk. Unmute your line, please. Okay, well, we're not having such great luck here, and I've promoted you to
Now, can you hear me?
Oh, we can. So yes,
Oh,
you have a story to share, right?
yes. And this is from one of my clients. My name is Vangelie, by the way.
Thank you, Vangelie. I'll say it right next time.
I have a client that has a growth on her pituitary. And so she had a procedure done and she's allergic to the contrast dyes. So they gave her 3 doses of prednisone and she really does not do well from the last surgery with that. And so she, her face swells up, her neck, her jaw, she gets a severe headache and heartburn. And she took the patch, and I believe it was the X39, to the hospital with her and put it on, and it stopped the headache. She didn't swell up. And there wasn't any bruising. And the other client mentioned that she had a nosebleed. X39 on the nosebleed, it stopped it right away. I have more, but I'm done.
Thank you. Thank you so much, Vangelie. That's beautiful. And isn't it? Yes, carry your patches at all times. I carry one of our doctors, Dr. Tiana, calls it a first aid kit. So I always have them with me. So thank you for that. Okay, so now we're going to go to a question from Jim and Wendy. Says, what's the best combination for overall soft tissue issues from a wreck?
From a car wreck, I guess, huh?
Yeah.
Yeah, any trauma. Well, again, X39 is a regenerative holy grail. Yeah, and so we are constantly damaging ourselves, whether it be through athletic or injury or just ongoing normal physiology. We have a technology called AEON, AEON, and we market it for stress and anxiety and mood. It really is fantastic for the entire brain. Anything you're thinking of that is a brain function, AEON is wonderful, and it also is the stabilizer. So when we have an emergency, the body very correctly shifts over into fight or flight mode, shifts the sympathetic drive, and unfortunately, we're in a place where we have chronic hyperadrenal sympathetic drive, chronic stress, and a lot of folks, their tickers are way over here, right? It's just how we've come to learn how to live in modern life, and we don't come back to center. The rest and relax phase, by the way, is called parasympathetic, and AEON is, this whole system is called the autonomic nervous system. AEON patch, AEON, if you want to look up on the website at lifewave.com, or the person who invited you to the call can send you some information on it. And AEON helps this. This is a very fragile state for a lot of people, right? And depending on how fragile we are metabolically and how much practice we have, this can be a very upsetting, that sympathetic tilt can be very upsetting. How quickly and powerfully can you come back here? And how much leeway do you have there, right? What if that center part of autonomic stability is strengthened? And that's what AEON does. It actually creates a flexibility and a stability there. It's a comfort zone. And then all of a sudden, you don't, then when you do have an accident or something, or a stress or some unpleasant events, you come back very quickly. So that's just in general. As far as how to recreate from a trauma, first, AEON is wonderful, right? Because it's an upsetting event. So it's an emotional help. And then what we pointed to before, those capillary bed dilations are a very good idea. So energy enhancer, we talk a lot about energy enhancer for athletes, but it's fantastic too, to bring to the soft tissues, to the neuromuscular competence, because it enhances blood flow.
That is I love learning from you. Oh my gosh. The
Yeah.
Eon patch is, and you being a brain gut guy, if people are whacked out of their autonomic nervous system and then they try to eat, we got a whole nother set of problems, don't we?
Yeah. Carnosine is also really great. We talk about carnosine in a antioxidant in a metabolic way a lot. We have a patch called glutathione. So anybody who's got metabolic syndrome of any kind, if you have chronic issues, you probably are glutathione deficient. Glutathione is the master repair signal in the body, and it helps recycle all of the other antioxidants that we take, like your vitamin C and all the other good stuff, hundreds of species of antioxidants. So we talk about carnosine almost in the same way often for metabolism, but carnosine is also very good for trauma. And in fact, you can put it right on your heart. Carnosine is a squeeze. It's called carne because meat, right? It's great for muscles, great for muscle health. And especially, here's the prime muscle, right? You put carnosine right on your heart, and a lot of times post-traumatic is handled very nicely, creates a nice squeeze and some nice circulation.
That's beautiful. Thank you so much for that.
Yeah.
Okay, we have a story from Moto. So you should be able to speak now, and you want to unmute your line, please. Well, you disappeared. Okay. I don't see you anywhere. So we'll go to Katie and Jake, and you should be able to talk now. People are disappearing. This is very interesting. Okay. So we're going to try one more. Kathy Smith. Can we hear you? Okay, we're not hearing anybody. Well, we got one. That's good. I don't know what's going on. So we'll go to another question or two. We're a little bit after our time, but are you up for taking a few more questions?
Sure thing.
Okay. Let's see. If a person, this is Kathleen, has acute discomfort on the right side of the body, how is Icewave placed? As for an example, pulled muscle on the right side of the back. You put the brown patch on the discomfort. Where do you put the white patch if you can't place it to the right?
Yeah, it doesn't have to be to the right. Brown patch is on the site of discomfort, and then we have what we call the clock method. So because it acts so quickly, literally in seconds, you can put the brown patch right at the site of the injury or the soreness, and then hold the white patch. So if you have a little shoulder tenderness, you put the white, put the tan patch there, and then just experiment. Hold the white patch on the front of your torso, on the back, maybe even under the armpit, that sort of thing. And just hold it there for 15 seconds and take a nice deep breath and see if it's working in one place better than another. And often people will find one place that really is most poignant. The good news is, even if you can't feel it, it is a total body activation and it is working, even though sometimes it's not evident right away.
Beautiful. Thank
Yeah.
you. Thank you. Let's see. What would be the best patches for an aged brain and recall? I have a mom on X39 and carnosine, but I'm not seeing much of her recall and self-care capabilities.
Eon, as we mentioned, is fantastic for neural stabilization and brain health. X39 across the board. And I have been falling in love in recent months with SP6. We have a patch called SP6. It's called that because a lot of these technologies were developed, and the clinical trials that we've done were done on meridians in the acupuncture world. And so SP stands for spleen, and the spleen meridian runs down the left side of the body. It's one of the main reparative and lipid mobilization issues, right? So in my world, that's immune competence. It's fantastic for immunity. It's also great for when you're thinking about brain repair. There's nothing happening in the aging brain that's not happening in our brains, right? The difference is when the damage occurs in the central nervous system, and if you can't clear it, if you can't take out the trash and you can't remove the metabolic waste, then all of a sudden it looks old. The body does the right thing and starts scarring off that area. So it's the same, it's the same thing. The idea is, how do you get the repair lipids in every part of the body? Regenerative medicine is based on the idea mobilizing cholesterol and mobilizing repair fat. Those are two words that, got a bum rap in the past couple of decades, but we're finally dismantling a lot of that ideology. Low-fat diets were shown to increase the risk of stroke, increase the risk of heart attack, increase the risk of just about any disease, right? We need fats, we need healthy fats, and we need, it doesn't mean you have to eat fat, although it's a great idea. Nuts, seeds, oils, nice variety of, if you do eat animals, eat nice healthy animals, grass-fed butter, all kinds of things. And when you can mobilize those lipids to the tissues, then you're getting the repair capacity. SP6 does that brilliantly. We market it, and you go on the website, it's marketed very simply as helps sugar cravings, right? And we all know what disease states go along with sugar cravings. So it definitely helps that. It helps all kinds of other cravings too. And the reason it does that is because it puts the body in a place where the body can bring the repair to the tissues. And then the body doesn't have to crave, because it actually has a capacity to mobilize the nutrients, right? And then it doesn't have to crave and hunger. Craving is craving is the right thing for the body that really doesn't have enough. And when we can put that back in order, then we're in good shape. SP6, I love it for brain health.
That's wonderful, because a lot of people don't know that. I mean, not everybody reads the clinicals at the level that you and understand them, and to realize it does affect the brain. So we have, how many patches do we have that affect the brain?
I don't know how many patches we have, but every single one of them affects the brain.
Okay, there you go. Well, let's go to, let's take one or two more. Someone mentioned about what does altering gene expression mean? We say that the GHK copper alters gene expression of over 4,000 genes. What does that mean?
Yeah, you can think of it as the habit that the body is used to, I think, is maybe a nice way to say it in a big umbrella kind of a way. We have about 30% of the human DNA we know, right? About 70%. We used to call it junk DNA. Now it's very, very clear there's no junk. Nature don't make junk, right? And that stuff is either flipped on with our lifestyle choices, or is flipped off. And the body has an enormous capacity for flexibility and to become something different based on what air it's breathing, what food it's eating, like that. And so I think that's an easy way to say it, without diving into too many details.
Okay, great. Well, let's do one more. Elizabeth is saying, when someone's getting better because they're using X39, can they overdose on their medications?
That's a good question. We're not allowed to practice medicine on this call, but the answer is yes. And that's why it's a very good idea to tell your doc, hey, I'm about to entertain, I'm stepping into a protocol that's going to help my body work better, right? And one of the reasons we use extremely high doses of medications is because that dynamic I mentioned before, the body, most bodies in a chronic inflammatory state cannot bring those drugs to the target tissues. When you put the body back into a place where the target tissues are actually being penetrated better, more effectively, then that might be an issue. Yeah. So it's good to tell your doc what you're up to. Maybe even tell him very excitedly, this is a way that I might be able to alter what you've told me we're going to do for the next couple of years, and we could alter that.
That's beautiful.
That's safely said.
This is wonderful information. Thank you so much, Dr. Tom. It's been great to learn from you, to share your wisdom and understanding of this technology and these patches. I want to thank everyone for showing up tonight, or whenever you're listening to this. The recording goes on our YouTube channel, Live Younger YouTube. It'll be there tomorrow. You go to the playlist and you click on the Tuesday nights. And for those of you that are brand new and this is your first exposure to Lifewave, it's pretty darn exciting. So please get back to the person who invited you, and they can help you get set up in whatever ways best for you. We have a wonderful customer program, and if you're the kind of person that likes to share and get customers because the technology is so great, we have a wonderful distributor member program that has a generous compensation. So I want to thank all of you for being with us this evening or whenever you're listening. And again, please get back to the person who invited you. And thank you, Dr. Tom. Wonderful to have you.
Thank you. Have a
Bye,
beautiful night.
everybody. Okay, bye-bye.